Good evening and welcome again. I'm Sheila Balgobin and I am the Dream Decipherer, and I help you to crack the code of your sleep and dreams so you can sleep sound and dream deep. This evening I decided to take a look at more unusual and rare sleep disorders. They may occur rarely, but they can have a major impact on those who suffer from them, and as well as the people around them. And the effects can range from mild and relatively harmless to actually being deadly. So the first of my seven unusual sleep disorders is called the Sleeping Beauty Syndrome. The formal name for it is the Klein-Levin syndrome, but it will cause sufferers to sleep up to 23 hours a day for days or even weeks at a time. And despite the name, the disorder primarily affects young males around the age of 15, with the symptoms prevailing for around 8 years and even longer in women. When this disorder is experienced, sufferers sleep nearly entire days away for several days or up to weeks at a time. It's also very difficult to wake them up, and when they do wake up, they are often exhibit very strange or unusual behaviors or excessive behaviors, such as binge eating, a heightened sex drive, apathy, childlike behavior, compulsive behaviors, confusion, and hallucinations. But between the periods of time between bouts of the disorder, which can last from between 6 months to a year, the sufferer may actually have normal sleep patterns and behaviors. As far as I can tell, there isn't any research exactly around this as what the relationship is between the incidence of this particular syndrome and what triggers it. But moving on from there, we come to sleep paralysis. And during sleep, our body cycles between REM sleep, where we're dreaming, and non-REM sleep. During REM sleep, the brain activity increases almost to the point where it's similar to being awake. But there's a mechanism in the body that prevents us from acting out on whatever's going on in our dreams. But occasionally, some people will wake during REM sleep and their bodies will feel as if they're paralyzed. And during this time, they're aware of their surroundings, but they're unable to move or speak. Now, many people who have experienced sleep paralysis have reported visual and sometimes auditory hallucinations, as well as you can imagine, intense feelings of fear or panic, and even a shortness of breath. Many sufferers also report feeling a presence in the room or even something or someone on top of them crushing the wind from their lungs. Sleep paralysis is actually fairly common, and it's estimated that some 50% of people will experience at least one episode of sleep paralysis in their lifetime. But only about 4% of people have had more than 5 episodes. As terrifying as sleep paralysis is for the sufferer, it is virtually harmless, and most people are able to regain movement of their limbs after a few moments or minutes. However, going back to sleep is another matter. After such an experience, it may take people quite some time to fall back asleep again. Another unusual disorder is REM sleep behavior disorder, and this is at the other end of the spectrum from sleep paralysis. So what happens in this particular instance, the body does not become paralyzed during sleep, so that people will actually act out whatever is going on in their dreams. And this can be very frightening, especially when the dreams are acting out violent behaviors such as yelling and screaming, punching, kicking, thrashing, jumping out of bed, and even running. REM sleep behavior disorder can lead to injury for both the dreamer as well as the partners or family members around them. There also seems to be a link between this disorder and other neurological disorders, and there seems to be associated with disorders like Parkinson's disease, dementia with the Lewy bodies, and multiple system atrophy. And those who have REM behavioral disorder are also 65% more likely to develop these other disorders years or even decades after the symptoms have first appeared. Now, this next one, it sounds really, really horrible, but it's not quite what it seems, and it's called the exploding head syndrome. And it may sound like something from a Hollywood film, but it's a real disorder, and nobody's head actually explodes. Sufferers of this particular syndrome, or EHS for short, experience what's called a hypnagogic auditory hallucination, which means that as they're beginning to fall asleep or just after falling asleep, they're startled awake by some kind of extremely loud noise. People report sounds similar to explosions or gunshots, doors slamming, people shouting, or even cymbals crashing together. Sometimes this is also accompanied by visual hallucinations of bright flashes of light. And while this is very, very frightening, there's no pain or residual headaches as a result of this experience. Most sufferers do report feeling panicked or anxious before waking and after waking, as you can well imagine, which is a pretty normal response. So while exploding head syndrome is not a harmful disorder in and of itself, those who have persistent and recurring symptoms can actually develop a phobia about sleeping, which can lead to developing another sleep disorder, which is called sleep onset insomnia. Now, this next unusual sleep problem is really, really quite serious, and it's called fatal familial insomnia, or FFI. And this is a condition which begins with having trouble getting to sleep one night and steadily increases until within a few months, the sufferer is no longer able to sleep at all. And it's not actually the lack of sleep that actually proves to be deadly for the sufferers, but rather the symptoms that accompany this inability to sleep. FFI is a very aggressive disorder, apparently, and is not currently treatable, although some of the symptoms may be treated. This can go on from 6 months up to 3 years with an almost inevitable progression towards coma and death. It's just as if the person has become so afraid of sleeping that they never sleep again, and the body just cannot function without proper sleep. The symptoms of FFI include things as, of course, sleeplessness, but high blood pressure, a rapid heart rate, excessive sweating, difficulty walking, muscle twitches, hallucinations, obvious weight loss, dementia, and ultimately the person will die. As I say, these are all rare disorders, so it's not something that will occur very, very often. It's a tiny fraction of the world's population that actually suffers with these things. The sixth unusual sleep disorder, is the non-24-hour sleep-wake disorder. And what happens with this disorder, it's where the circadian or sleep-wake rhythm is disturbed and is frequently, particularly common among people who are blind. People with this particular sleep disorder find themselves gradually going to bed later and later each night and waking up later and later each day until their sleep cycle actually gets flipped all the way around. So night becomes day and day becomes night in essence. And because its circadian rhythm is based on light, particularly sunlight, you can understand why people who are not sighted have trouble with this, because it's all the same. There is no way for them to distinguish necessarily day from night. The last of my unusual sleep disorders is periodic limb movement disorder. And this simply means that there is a characteristic rhythmic movement of the limbs during sleep. Maybe people are dreaming about walking or moving or something, but there's a regular twitching, if you will, of the limbs during sleep, which is similar to restless leg syndrome, which could have various causes. So there you have it. It's 7 unusual and rare, I must stress that they are rare sleep disorders. But if is there any time that you feel that something is disturbing your sleep and it's been going on for more than a few days or even a week, then it's a good idea to have a phone consultation with your doctor. Or if this is something that perhaps you would like some suggestions as how to sleep better, you can contact me. Thanks so much for watching and listening. Have a wonderful evening and week ahead, and I'll see you again soon. Take care. Bye-bye.